The 3 monthly doctors' meetings at dementia facilities are very important. The doctor makes the all-important decisions around medication and placement. So it pays to get a copy of the clinical notes, which you can get through the authority of the power of attorney pretty much from day one when the person goes into a dementia unit. And when reading these clinical notes, note anything to do with mood, medication, and behaviour, because if any of these aspects change, there can be big repercussions. And if you're well informed in terms of the clinical notes, and also if you have good communication with the medical team, good lines of communication, then you can work with the medical team on these aspects to modify any effects that may be resultant with your relative who's living in a dementia facility, to be able to help them have a better quality of life and better outcomes, hopefully, with the whole arrangement at hand. So in terms of getting the clinical notes and needing the power of attorney's authority, that can also be a mission in itself. So if, say, for example, your sister is power of attorney, and you're the brother and you want the clinical notes, well, you need to get authority from her to be able to get the clinical notes. So hopefully you're in good liaison or good communication terms with her so that she'll give the authority for that. Sometimes the clinical staff will give you the clinical notes if they know that you're a regular visitor of, say your mother. They may, but generally it's the power of attorney that needs to okay it. Now, once you've got the clinical notes, they can be, it's a big wad of material, and, it takes some reading and, of course, a lot of terminology. If you're not clear on the terminology, try and get a friend or a family member who's a nurse or a doctor or, who's worked in dementia facilities, and go through the notes with them, those aspects which you don't understand, and hopefully they'll give you the time for that, because that's extremely valuable. You really do need to understand about the medication, the behavioural aspects, etc., from someone who works in the field rather than just Google. It's not really a good, idea to go onto Google about this, because there's so much to sift through. So it's better to try to get to the essence. So if you've got the clinical notes, say, and you've had a friend that's been able to update you on the details of the clinical notes, the second thing alongside is to make sure that you've got good communication lines with the clinical staff, well, really with all the staff in a dementia unit, from the carer to the nurse, to the clinical manager, to the doctor, and also the cleaners and laundry girls. Everyone plays a big part in the care for your mother in a dementia unit in all sorts of ways, and the laundry's important, to have all the, outfits clean, finding the hearing aids, the all-important hearing aids and glasses, the laundry girls, the carers, of course, with all the daily cares, showering, dressing, that's a major job. And they also assist with, well, actually they serve the meals and assist with feeding and drinking if needed. And then, of course, the nurse with all the medications and dressings, and the clinical manager having an overall view of everything that's going on, everything being computerized. Everyone is meant to be upskilled on every aspect, but of course the specialty area, say for example with the carers, with the showering and dressing, it's always good to go to them about such things, because they're working with your mother, say, on a daily basis. So say you've got the communication lines in place, you've got the clinical notes, you've read up on that, that means that you're well placed for any behaviour change, mood change or medication change, which can happen very quickly in a dementia unit. And if you're not upskilled in advance on this, it really is too much of a rush to try to upskill on the spot. You can't just absorb all that material of clinical notes and medication in a day. It can take weeks to be able to absorb all the information that's needed to be able to go into a doctor's meeting and be informed and be able to ask informed questions. If, for example, your mother's had an aggressive incident, it could be a provoked or unprovoked aggressive incident, they're taken very seriously in dementia units, because of frail residents living there, and attacks and aggression, you know, have big ramifications. So if that happens and your mother's, maybe she's never had an aggressive incident in her life and all of a sudden she's being aggressive, you don't know what provoked it. It could well be that someone has provoked it. But all of these things you will get to be privy to if you visit often. You will know who is likely to be provoking your mother. If you go visit, say, 2 or 3 times a week, you'll know the daily goings on. And in that way, when you're at the meeting with the doctor, you can discuss it and say, well, look, you know, it was, for example, an aggressive incident, but actually that woman, I witnessed it myself, that woman came up to my mother and wrist burned her, you know, twisted her wrist. And so my mother lashed out at her because she was being, well, not just provoked, but an aggressive incident with wrist burning. And, you know, you'd actually witnessed that twice. So if you can say that to the doctor, that's going to make a big difference in the result of, you know, the care, the program, the plan, rather than unprovoked aggression, which is taken more seriously. So in this way, look, it's complex actually, really. When aggressive incidents happen, you know, there's so much bureaucracy that goes on in terms of time, the date, the detail, people involved, witnesses, it goes on and on. But the main thing is to just be upskilled as much as you practically can be on all aspects. And so then, of course, you are the advocate for your mother. You're the voice for your mother. She generally, people with dementia can't speak on behalf of themselves at doctors' meetings. I mean, it's far too complex. So you need to be her voice. I mean, you can speak to your mother a little bit about it before the meeting so that she knows what it's all about and she's orientated. I mean, if she's being aggressive and you've actually witnessed her being aggressive, you'll need to take her to task on that, you know, and be assertive with her and say that she is going to have to settle down and get a grip, and however you speak to your mother on such things, because if she doesn't settle down and, you know, control her behaviour, there will be ramifications. Either medication will be increased and all the side effects of that, or she'll have to go to another facility where there's more restraints. I mean, yeah, I mean, it does need to be explained. In fact, I've had occasions where aggressive residents have, you know, either got the choice of changing their behaviour, being medicated, or going on to another dementia, higher level dementia facility where there's restraints. And I've explained this to this particular person and they got it. They got it. They were able to modify their behaviour enough to stay for another year at the dementia facility. But then things changed. The support of the family reduced a lot. The favourite son left for overseas and the lady wasn't able to. She just felt that she didn't have the support to control her behaviour. And in the end, she became quite confused and just felt that no one understood and became really aggressive and had to actually go on to a higher level facility. But if the person has the support and you can communicate things with them, especially if it's the lower level anger, and you catch all this at the lower end or after the first incidents, you can, with a lot of support, as explained, turn the tables. So it's a complex area. I'm going to do 2 more videos on this as well, the next 2 videos I'm doing on this topic. But in terms of particularly on doctor's visits, medication, aggression, and all the complex aspects around this, I've gone into detail on this topic in the book, The Resident's Voice from a Dementia Unit, which you can get on Amazon or on my website in the description below, www.pietavalentine.com. So if your parent is being aggressive, it's a lot of work for you to upskill on all of this. I'd suggest to read the book, to watch the videos around aggression, these past YouTube videos, and really work hard with the medical team, be informed, and, you know, try and turn the tables so that you can get the best outcome for your mother. Thank you for your looks and your likes, your correspondence. Thank you.